So I actually picked up a very narrow topic for today. I mean, if you look at democratization, there's a lot of things going on. Like globally, I think we're spending about somewhere between $6 and $8 trillion on healthcare. There's a huge industry. So there's a lot of innovation going on. So it's practically difficult for someone to keep pace with everything that's going on. So I'm going to pick a thin sliver of activities where I see it, and then I'm going to give my insights. So I've been fortunate to have multiple perspectives in my 20-plus years of experience. I was one among you, the CIO, CTO, so we're making decisions on technology, suppliers, who putting bets on behalf of my company. On the other side, putting bets on how to solve some of the problems in an entrepreneurial fashion as well. So, and I've lived in the US for many years, lived in Germany, lived in China as well. So it's just a blending of some of these insights I'm going to share with you. So before we go into my presentation, so I'll try to catch up for some of the time so you can get more questions. So how many of us have, just a simple raise of hands, has had a medical situation with you or with your family that you had to consult somebody? Just a simple thing. I would say pretty much 80 to 90% of people in the last, let's put it this way, even if you narrow it down to a year or so, diagnosis or finding out what's going on, it's actually, so what do most people do? Ask Dr. Google, first thing. Right? I think this has become in the very de facto way of saying, look, I have a headache, it's been a nagging headache, and I just came on a flight, like an 18-hour flight. You know what, do I have DVT? So I just wanted to Google and find out what's the symptom of DVT, right? So a lot of us intuitively go find Google or WebMD, whatever these online portals are. I sort of make this point in a joking way about Dr. Google, because if you see the internet surveys, people's perception, it's granted it's more US-centric research, but 80% of the people are a significant number. So maybe give a plus or minus if depending on the internet penetration. A lot of people go online to find out the first initial triage. Hey, what's happening, right? Diagnosis. So mentally you're doing a diagnosis in your mind, right? And actually if you look at even drilling specifically, about 60% of the people, they want to know specific details of, look, if I'm facing X, Y, and Z, the symptoms, what does it mean? Should I do something? Should I intervene? Or should I say it's okay? So I think a lot of us use that very simple Dr. Google, as an example. But this also is an interesting point. Dr. Google actually is an AI or sort of it aggregates a lot of the things. That's essentially what it does. So without calling it AI, without calling it machine learning, without all these things, we are actually using some of these things in a way, right? So I'm going to weave the story through a little bit of a, is it half full or half empty thing, right? I'm going to speak for both for and against, and sort of it's going to be an interesting thing. I'm not making any predictions here, but I'm going to share my insights and perspectives. So I think the answer is somewhere in between. Is it the wanted power of AI is going to transform, so you're going to have a doctorless society? Is that there, or it's just a fad? So I think there's somewhere in between things that are emerging. And Vernon's presentation was actually spot on. IoT transforms new businesses. I think if some of you are looking at, I'm at a stage where I want to transform, get a new business model. There are building blocks there, and healthcare is one of those industries where it's really valuable. Ecosystem, I think we did a study, again, what it came, this is a sort of a reasonably good sized sample of healthcare providers. So which means hospitals and other really healthcare delivery organizations. asked them, look, give them AI in healthcare, a big poster to say, what does it mean? What do you want from that, right? Number one, diagnostics. Really finding out what's going on. That's actually number one. If you look at it, clinical decision support. I think that's clearly where you're sort of seeing a lot of interest, a lot of practical applications. And the reason is there is a finite amount of data all of us can keep in our head. Again, you may be an excellent physician looking at, so essentially, medical diagnosis is about pattern matching. You're looking at, look, set of diagnostics, looking at a 360-degree view and say, look, if X plus Y plus Z and this is all the things happen, there is a possible outcomes here. This is essentially what's going on. And there's no other better technology that brings it all together, the power of many to every transaction. So this is very interesting insight. Zooming in on the diagnostics, clinical diagnostics, there's something very interesting. Diagnostics is still about 3 to 5% of the overall healthcare spend. Somewhere it's 10, somewhere it's a little bit there, depending on the affordability, depending on everything else. But it's a reasonably good spend. So if you look at the projections, like healthcare is going to become from 6 to 8 trillion by 2020. So that's a good research that came up. 5% of 8 trillion is still 400 billion. That's a big number. And if you look at it, there's plenty of statistics. Some of them are really, wow. I mean, if you look at it, diagnostic errors contribute to 10% of patient deaths. Again, this is not every single thing, but it's a very, I've used it to highlight. It doesn't mean that you go to a hospital 1 in 10 chance of, that doesn't mean that, but I think there are cases where wrong diagnosis has led to a serious health issue as well. And if you look on the left-hand side, we face the healthcare system. I'm just aggregating about 100 countries. Say, look, there are countries that spend a lot of money on healthcare. There are countries that cannot afford to spend money on healthcare. Let's say, put it this way. So we have two issues mainly. One, there's a tremendous waste, up to 10% waste in misdiagnosis, wrong diagnosis, unnecessary diagnosis. There's plenty of waste going on. This is workflow related, as Varun mentioned also, business process related. If you look at it, there's a huge opportunity to bring in efficiency, bring in right diagnosis to say, look, reinvest these in wasted dollars, whatever currency you call it, into a productive thing. Another, on the other side of the coin, in some of the markets where basic diagnosis, access is missing, good quality access to good tools is missing. So a classic example, if you look at bigger population, I'll come there in a couple of slides. Diabetes, diabetic retinopathy. So I think in emerging markets, a simple screening of retinal image would prevent blindness in millions of people. I mean, this is to say 2018, we're still looking at people don't have access to a simple retinal scan that doesn't need very sophisticated tools or technology or equipment. It does need equipment, but it doesn't to be a big room with lots of magnets and all this stuff. So I think we are seeing huge waste vis-a-vis lack of access to basic things, right? Preventable healthcare issues. So what AI and some of these things we focused on is access, quality, and affordability, right? If you look at it, that's the three things. So just a little bit of a plug for my own startup here. So in my former role, I was CIO at Stryker, so I looked at to say, look, can we do some transformation of the business workflow, essentially the clinical workflow, post-joint replacement surgery? So I think there's still infection, surgical site infection. Can we do the power of wearable sensors and AI to do an early warning for preventable infections? That's what we are working on, digital biomarkers, where a non-invasive way, we collect the data, take it through an AI classification engine to say, look, is it good enough? Can we present it in the right way to a clinician so he or she can take a decision with data rather than just eyeballing to say, look, your knee is red, so I need to hit you with antibiotics. So that's clearly what we do here. But this access, affordability, and quality remain the fundamental challenges and the opportunity. So if you're looking at opportunity, if some disruptor can really take these three and provide to the market, that's going to be a good winner. So I don't claim to know everything that's going on in the industry, but what I step back, observe some of the themes happening in the healthcare industry. I think I've sort of bundled all of them together under 4 major themes. So it's workflow automation. There's lots of things happening, triaging to say, look, Dr. Google is one of those examples to say, look, you have these symptoms, you have these things, can AI, like chatbots and things like that, can we really make this automate the workflow? So that's, a lot of work is going on, a lot of companies that are investing, a lot of experiments that are happening there. If you look at another side, patient experience. I mean, I think we got folks from Amazon as well. There's plenty of research going on in the voice interface, voice experience, lots of things. So they're looking at collecting patient experience surveys, and if you look at the pain scores. So what was really done in a painful setting with somebody calling or sending a mailer, they're looking at improving patient experience. A lot of hospitals like Mayo Clinic, Boston Children's Hospital, Cleveland Clinic, they're doing experiments with saying, could we really communicate the wait times in ER, things like that. That's lots of small selective things going on, a lot of experiments going on everywhere. People are trying to learning to use these new tools and techniques as well. The last 2, predictive and preventive. So I think the question was asked, how many of us are wearing a Fitbit or an Apple Watch or things like that? A lot of us are doing, but like people say, look, I've done my 10,000 steps today, so I'm good. I mean, so is that good enough? So I think connecting it with an outcome and saying, look, could we use very specific like combination of diet and glucose monitoring to really keep your diabetes under control? There's plenty of work going on there, predicting and preventing. Like I'll take with who is interested, but it's just I wanted to give a bird's eye view. If you look at it, and there are other themes going on as well, but if you look at it, the first one, making it better for the 2 constituents, automation workflow, the providers, patients, and predictive and preventive to really move one level up in terms of the value of AI. So this is an example I talked about earlier. Plenty of work is with, this is an IoT device and AI. So I think one is thing of the intersection of these 3, the Venn diagram to say AI, IoT, and blockchain. This is a good example, a simple camera that with an algorithm that's been tested, and FDA actually fast-tracked this application on the de novo. What it says is, it doesn't need a doctor's help to do a simple screening to identify a person or a patient with diabetic retinopathy. That's a huge positive thing. Of course, there's plenty of research going on in different countries on the same or similar lines, but what we are seeing trend, FDA in particular, so they are not saying, look, you do something and come back, I'm going to regulate you. They're saying, look, let's partner with you and make sure that some of these things get into the usability space fairly quickly. This is still a class 2 device. It still needs to go through all the specificity, sensitivity, and positive prediction value, and all the things that it's a prescription device as well. But again, notwithstanding the threshold for this, but I would say this is sort of a breakthrough, the power of AI to do a simple screening without an expert there. And then, of course, once you identify, you shortlist people, the next steps can take place with the expert sort of doing the second level clinical decision as well. So I've talked so far about the half full side, like, okay, AI is changing, there's plenty of going on. I'm going to talk a little bit about half empty, right? Healthcare is very notoriously difficult to value. I mean, I think those of us who have been there, it's a chicken and egg, so you have to show enough evidence, enough data to get acceptance. And the mindset of a clinician, again, I'm not speaking for everybody, but I think most of them is say, like, if it's not broken, don't fix it. It's a longer evidence cycle to say, look, you have to really raise the bar so much to say, look, this is valuable for me. I think AdvaMed, which is industry body for medical device, medical technology, they came up with a very interesting, in collaboration with Deloitte Consulting, a value creation map, so to speak. And I'll actually touch very briefly. So if you look at it, the purpose of putting this slide is to say how many different stakeholders are there. If you look at the patient, the physicians, the hospital, the payers, the government, in some cases employer, because employer does the insurance, healthcare thing in the US and some markets as well. If you look at it, then the technology, how do you really define the value drivers? So even if a technology that clears some of the hurdles, I think we've seen that, look, great technology, but if it's not finding support with the payers, that doesn't see the light. And I think that's, so a cautious tale is a lot of these companies, they rush into new technology, but again, orchestration of these different things, different stakeholders, who do they need, what do they need, how to make it visible. So that's, again, I can speak from my own company's perspective, so which is we are going through the same journey right now. We've got a good technology, but orchestrating through the system is not easy. So I think that's, again, it's not impossible to do, but it's a half full, half empty case here as well. So I know there are a lot of people who love or hate the big blue, the IBM Watson. So again, look, I'm not here in any way passing on any judgment about Watson was a success or a failure. So Watson was a fantastic experiment to collect all the data in oncology to say, look, if it's the universe of knowledge and oncology exists, it exists in these boxes, right? Mixed bag, because they still couldn't really get that much hyped up, I would say, value expectation from the Watson service. There's plenty of reasons why they couldn't get it. One of my observations is, and it's also in public domain, the data. If you look at it, why? So I'm going to come back to that later, but I just wanted to say this is a same study done by Ecosystem. Why isn't it pervasive? I mean, it says like benefits are high, it's collective knowledge of millions and millions available to you on demand. It should be next thing to sliced bread. Why isn't it so pervasive, right? I think the answer is, again, a good sample set of respondents here. If you look at it from a corporate internal perspective, you just can't have standalone systems and deal with this data, in pockets. So integration with existing systems and other AI systems, that's the real power of AI. So I think if you look at it, respondents have said, look, there's still challenges with integration. That's why it hasn't become pervasive yet. thing is access to data. If you look at it, data, AI or machine learning, I'm lumping all this thing under thing. This doesn't come easy. I mean, if you look at it, these are really slides that sort of on the right-hand side to say, look, to increase the level of accuracy and in terms of prediction, it takes a lot of data points. It depends on the model that you choose, depends on the trade-offs. How do you teach these machine language systems to solve the problem? The data could be exponentially, the data requirements could be exponential. So I think I would just say for people here who are thinking about, hey, look, I have a specific problem. I believe we have an idea to solve the problem, but do not underestimate the value or the requirements of data, labeled data, because you got to train these systems, and these systems need that data. So that, and choosing the right model between putting a bias and the variance between the expected outcome and the predicted outcome. So there is a lot of details there. So it's not like I'm going to sign up for a TensorFlow account and then just go pull up a data set and start calling myself an AI company tomorrow. So it's not that easy. I think there is plenty of details in the background. So I asked you the question. Google doesn't have all the answers. I mean, that's a sort of the half-empty thing is, look, there's plenty of things on the positive side where we can collectively solve some of the bigger healthcare problems and diagnosis, make access to diagnostics in a democratized way, meaning cheaper, faster, better. But also, we have to understand there's limitations of actually using all the data to productive. So I just put it in, this is a t-shirt, I saw it in Chinatown, Singapore, to say, look, at the end of the day, you got to really take it with a pinch of salt and say, look, okay, potential is there, great case studies, use cases are there, and with the amount of investments in healthcare set to become, I think, 18 trillion by 2040, this is good research with World Health Organization and Washington, I think University in Washington State. Even if you discount some of the numbers, plenty of money is in the system. I think if we chart out a pragmatic course to say, look, narrow the problems to solve and then build the building blocks one at a time, I think that is an opportunity for success. So I think I want to leave you with this thought. That is great cases where its value is clearly there today. There's also pitfalls if you don't navigate this properly. So that's my insights. Hope it was useful.